We are back on Morning Line. Thanks for joining us on this Wednesday. Nick Barris, along with Clint Kelly. Can you tell who's the attorney here? All right, well, he's the guy in the suit jacket. Anyway, we're talking medical malpractice this morning. 737-7587 if you want to join in the conversation. I was trying to think about some of the other cases that we can hit on, and we'll take more calls as they come in. But you talked about blood clots being good. Are you dealing with any, right now, class action cases? Still, you had mentioned in the past you were doing one.
Yeah, I've got a few drug cases that are still around, and some hip cases. Defective hip cases.
So you're talking about the implants?
That's correct.
What was the issue on that? That just the ball doesn't fit right or something?
The metal in the implant was defective and it broke. And either one or two things happened. Either the actual implant itself broke and needed to be replaced, or after it was determined that the implant was defective, had to be taken out and have a new one put in so it wouldn't break. Okay. Kind of like it's a recall. Right. And a lot of these people have had some very, very significant problems having the hip joint replaced. That's another case, by the way, where blood clot prevention is essential.
That's what I've heard. And joint replacement, that's huge,
right?
It
is, because those people can't get around for a while. They're effectively immobilized, and so they are extremely high risk for developing blood clots. But I was wondering,
isn't that, with a lot of people, I have some people I know have knee and hip replacements, they're told literally a day after that surgery, which is brutal. If you ever see those surgeries, they're hammering away, but that's what they're supposed to get up and start walking the next day, aren't they?
They try to get them to quote unquote ambulate.
Yeah, right.
That's not enough. I mean, those people, they may get up and maybe even take a step, but they're right back in that bed. They're going to stay in that bed, and they're not going to get up for anything. And some people say, well, gee, I may lay in my bed 3 days while I've got the flu and not get up. Well, when you're at home, it's different. You roll around in the bed. You can get up and go to the bathroom. Sometimes you can get up and go get something. At home, you're much more likely to get up and move around, whereas when you're in a hospital bed, you're basically a captive to that bed. You're not really supposed to get up. They may give you bathroom privileges, but you're not supposed to get up and move around anywhere unless they tell you.
Yeah, but you're not saying, I mean, I don't have to worry about blood clots if I'm not injured or had surgery and I'm sleeping, right?
Correct.
I mean, you're right?
Correct.
I mean, sometimes, I get pretty lazy. I'll sit on the couch all day watching football.
Usually the cutoff or the point where it starts to become a problem is after 3 days of immobilization. And that's a person that is likely to develop a clot because there's something about them. Gotcha. They may be hypercoagulable, they're older people, they tend to have had previous problems with blood clots. Those are the people that really need to be up and moving around and not stay immobilized more than 3 days. One big story Clint and I had done, I think was it last year, the year before, I guess, I don't know, sterility clinics, what would we call them? Oh yeah, the sex clinics.
The sex, the sex clinics. And it's funny, because I listen for them now, and I'll hear them a lot, more often than not on sports talk radio.
That's right.
Of course, it's to target a male audience, but what are your feelings on this? They can be fly-by-night, they come and go, and I understand some of them can actually help folks, right? But what's the problem? Well, a lot of men use these. The problem in the cases that we had were problems in failing to get informed consent from the patient, so the patient understood what risk he was undertaking by agreeing to the treatment. Because the treatment in and of itself has a risk of causing permanent impotence. I mean, these patients that go in there, they're typically not patients that have problems with impotence. They're patients who want an extra kick. Okay. There may be 55 or 60-year-old men who want to perform like they're 40 again. Right. And the reason they're there is because this clinic promises them that we can do that. And then they get this, it's a shot directly into the penis that creates an erection that lasts for a long period of time. The problem is the actual medication that's injected into the penis may not wear off, in some cases 4, 12, 24. Had one case where the erection lasted 48 hours. Well, if that happens, that blood will congeal and it will damage the soft tissues inside the penis, and if that happens, you can't get an erection again. Well, yeah, the client that you had basically had his genitals destroyed. That's correct. He cannot have sex anymore. At least he can't obtain an erection. He'd have to have a penile implant. Okay, and that was because, and this was a case because the treatment he was given, it wasn't, and you've got experts that testified on the other side, was not up to the standard of care. Well, this was worse, Nick. It wasn't just the failure to get consent. It was also the fact the man didn't even need the treatment. Okay. That was the problem. He needed something else. He didn't need something this drastic. And there are, they can give Viagra, Cialis. There are various tools that can be used. I'm going to get into all that now, but
he was not an appropriate candidate for this procedure.
Right.
And yet they talked him into it, and then after they talked him into it, they didn't tell him about the risks, and then all of a sudden he's in. But he was 45 and married. You know the rest.
All right. And you said these clinics that do this, they can be very lucrative, I guess.
Yeah.
Obviously.
It's cash business.
It is.
It's cash.
It's cash.
Yeah.
And they come, and sometimes they'll be here for a while, and then they go.
Yeah, insurance isn't paying for this. These people are paying cash to these clinics. Sometimes they'll operate under the guise of, we're going to give you testosterone treatment as well, because they want to sell the testosterone therapy. But the cash is made on this treatment involving injections into the penis. That's where the money is.
Okay, yeah. Well, and there have been a lot of cases like that, and you handled the one. I wonder, do you ever deal with anesthesiologists where mistakes are made in anesthesia? Can you talk a little bit about that? So a friend of mine had asked me to ask you about that.
Yeah, we have one case right now where an anesthesiologist passed an endotracheal tube down a patient who had a very, very small area to, let's just say it's kind of a smaller windpipe.
Yeah, windpipe to go down, yeah.
And this anesthesiologist ironically had worked on this patient before and knew this. And you have to pick the right kind of tube, right size tube to pass down. You don't want to pass a tube that's too big.
Damage it.
That's right. Well, that's what happened. And when he tried to pass it and get it through there, he damaged the patient's vocal cords. She can't speak.
What?
Yeah, she's a mute now.
So she comes out of the surgery and she can't talk.
That's right. She can't
talk.
because
this thing, is it going to heal?
No, it's permanent nerve damage to the vocal cords. No.
And she can't talk now?
She can't talk. She has no muscle control over the vocal cords. That's what makes sound.
This was one of your clients?
Yeah, it is one of my clients.
How do you handle this case? I'm just wondering, for people that, you have something like that, and you say some cases are stronger than others, obviously.
There's a letter in the file where he actually wrote a letter to other anesthesiologists saying, if you work on this patient, you must use X size tube, not Y, because this patient has a smaller windpipe. And for whatever reason, when he worked on her, he forgot his own letter and put the Y tube in there.
Well, wouldn't you feel as you're going in, it's kind of snug? Maybe I'm not. All right, so is this one just a matter of what kind of settlement you're going to get? And you don't always, and that was the other question I was going to ask, you'll litigate, and
sure.
you don't mind being in the courtroom,
sure.
But typically a lot of these cases will be settled outside of court because I think the hospitals want to avoid the bad publicity.
Most of them do, but you may have the doctor say, I don't know what this guy's going to say. Of course, he denies negligence, but he may say, look, I wrote that, it was in the file, but at the time, that's what I thought. And then when I evaluated her for the surgery, I thought perhaps I could get this tube down because it didn't look as constricted as I thought. And in my judgment, it passed through smoothly, and gee, sorry that this happened, but it didn't, I did everything I was supposed to do in passing the tube, and nothing led me to believe that I was damaging vocal cords. They do that all the time. And it's like medicine's an art, not a science. It was clinical judgment on my part. It was a judgment call. If it was an error, that doesn't necessarily mean I'm negligent. An injury doesn't presume negligence.
Sure.
So they go through all that, and by the time all that spills out there, then you've got a hotly litigated case.
Oh, no, exactly. What you just said there, okay, that kind of, because I was like, how is he going to defend?
That's the defense.
And you'll argue back saying, look.
You knew.
You knew. Yeah.
You made the choice. You made a choice to proceed with this, notwithstanding the fact you knew that this patient had a constricted airway and that this patient could not tolerate a regular size tube, and instead you chose to go against your own assessment and pass the tube.
That's the trick here, that letter. Now, had that letter not existed and he still destroyed her windpipe, would that potentially still be a case? Or he could say, look, it went down, I didn't realize it.
Much tougher case.
Much tougher case without the letter. But the letter, I think, really, you knew.
It's a smoking gun from our standpoint.
But clearly he forgot it. If he wrote that letter and remembered it, he would have not done the
correct. But like we've always said, Nick, the defense will be, this was a bad outcome.
Right.
Bad outcomes happen. Bad things happen to good people.
Sure.
And I did everything I was supposed to do. Yes, that letter was in the file, and yes, I knew that at the time, but I made a clinical judgment this time around that I was wrong about the first letter and that I could pass this tube easily, and I did pass this tube easily. It just so happens that, during the process, hurt her vocal cords, and that can happen sometimes.
Such interesting stuff.
Yeah.
All right, we'll take a break on that note. Come back, our final segment, and we'll take a few more of your calls, 737-7587, right after this. Stay with us. Wow.